Conventional treatments would include high-intensity focused ultrasound, photodynamic therapy aimed at blood vessels to prevent the feedback of cancer cells, targeted therapies or PARP, inhibitors that target the prostate-specific membrane antigen, immunotherapy, surgery, and hormone therapy. This would be some of the most active treatments for prostate cancer. As a preventive measure, more than 30% of cancers, as mentioned earlier, could be prevented by changing eating habits, according to the WHO. Drinking coffee isn't as bad as it's made out to be. It's not as bad as they say. I suggested that people drink coffee because it's good for Parkinson's, for example, and it's also good for prostate cancer. Coffee reduces the aggressiveness of prostate cancer. The important thing about coffee is to drink it in its natural roast and without sugar. When coffee is roasted, which is coffee that's already burnt, it's also burnt with sugar to make the flavor much stronger, much more intense. People think that a coffee with a strong flavor means it's good coffee, but in reality, you've lost all the benefits of coffee except for the caffeine. Benefits of coffee: the coffee is antioxidant. We know that coffee has anti-cancer properties. It has effects on aging. It helps with fat control, and it also helps with blood sugar control. At the same time, it's a cardiac tonic. It can also be a stimulant, and it helps patients with Parkinson's. It has a lot of functions, and one of the effects it has, among other things, is due to the chlorogenic acid it provides against cancer. But coffee, I recommend drinking coffee to a lot of patients. Natural roast without sugar, natural roast and without sugar. Men who drink coffee have a lower risk of advanced prostate cancer, so it's healthy for patients who have prostate cancer. The reduction of prostate cancer is also associated with the consumption of tomatoes, specifically cooked tomatoes, which are concentrated, green tea that contains epigallocatechin gallate, and the intake of cruciferous vegetables that have indole-3-carbinol, alpha-lipoic acid, both oral and intravenous. Depending on the type of cancer and how advanced it is, we can give alpha-lipoic acid in doses of 300 to 600 milligrams, or we can administer intravenous infusions of alpha-lipoic acid and also vitamin C. Radiation therapy, combined with hormone deprivation, can reduce the risk of death by 43% in men with high risk or locally advanced prostate cancer. We know that micronutrient supplementation is linked to improved survival in patients with solid tumors and for the protection against prostate cancer. Vitamin E, selenium, and soy derivatives, which are estrogenic, have high chemopreventive activity. Soy taken daily lowers PSA levels without affecting testosterone. Since soy is more estrogenic, men who consumed soy experienced a 14% decrease in PSA levels. It's estrogenic and can have effects against prostate cancer through non-hormonal pathways. Vitamin D also enhances the effect of medication or the survival rate in prostate cancer. High doses of calcitriol extend the life of patients with advanced prostate cancer who were taking Taxotere, meaning it enhances the activity of the chemotherapy medication the patient is on. Taxotere is a substance used in androgen-independent prostate cancer, and this combination increases survival by 49% compared to the group that only took Taxotere without vitamin D. Zinc is a tumor suppressor, it's anti-cancer, it's an immunomodulator, and it's anti-inflammatory. It also alters the biology of prostate cells, making them less likely to undergo malignant transformation and less capable of multiplying and surviving as cancer cells. Prostate tissue has zinc levels that are 10 to 15 times higher than other tissues. I remember that the eyes are also very rich in zinc. High levels of zinc are an essential factor in preventing the onset of prostate cancer. We've seen it before. It's a significant 68% decrease in zinc levels in cancerous prostate glands compared to non-cancerous ones. Zinc induces apoptosis in malignant prostate arteries and inhibits cell migration and invasion, meaning metastasis, and it could sensitize prostate cancer cells to the effects of sorafenib, another chemotherapy medication. Sometimes we can use, as we've mentioned before, integrative medicine. We can use two forms of treatment that enhance each other, making them much more effective for treating a patient while avoiding side effects and being more effective at destroying cancer. In this case, we know that turmeric is an anti-inflammatory. We know that turmeric is also an anti-cancer. We know that it's also an anti-diabetic. Turmeric isn't a strong anti-diabetic, but it does have an effect on sugar as well. At the same time, turmeric improves and thins the blood, and it also has a positive effect on oxygenation. Turmeric inhibits the growth of androgen-independent prostate cancer cells, and there is a synergy between turmeric and bicalutamide, which is an androgen receptor antagonist. That means it's not just about androgen-independent cancer, but also about androgen-dependent cancer. And it's combined with a chemical medication that will enhance its effectiveness. What does turmeric do? It decreases the growth factor that's related to the growth of tumor cells. It decreases QX2, which is an inflammatory process, and it decreases tyrosine kinase, which is related to the growth and proliferation of cancers. It has anti-inflammatory activity, of course, and it increases apoptosis. Taking 2 to 4 grams a day induces the condensation of cellular chromatin, cell shrinkage, fragmentation of the DNA in malignant cells, and blocks the cellular translation signal, which is characteristic of apoptosis. Turmeric is said to be beneficial for all cancers, but it's also very specific for lung cancer. Flaxitoid or flaxseed oil, the supplementation with flaxseed, not the restriction of fats in the diet. That's a study that was done. Reduces the rates of prostate cancer proliferation in men before surgery. The results indicate that the men were in the protocol for an average of 30 days. The proliferation rates were lower among the men assigned to flaxseed oil. The median proportions of positive Ki-67, which are the total nuclei, was 1.66 for the diet with flaxseed supplement, 1.50 for the diet with flaxseed supplement and low in fat, compared to 2.3 for the control subjects. That means the control subjects continued to see tumor growth. And it was 2.56 with just the low-fat diet, which also continued to see tumor growth. The enterolactones from flaxseed oil inhibit angiogenesis, promote cellular apoptosis in animals with prostate cancer and in other types of cancers, and also in what would be hormone-dependent cancers in women. The enterolactones from lignans easily penetrate the bloodstream and protect against hormone-dependent cancers in both men and women. Resveratrol and sirtuins can block the growth of prostate cancer. Sirtuins, or SIRT, are a gene involved in regulating the mechanisms of aging. In fact, resveratrol stimulates sirtuin-1 and respiration. Initially, remember that it was only related to anti-aging treatment, because sirtuins have an effect of delaying the aging process, similar to caloric restriction. Activating delays in the aging processes is triggered by caloric restriction and by taking resveratrol, which can block the growth of prostate cancer and also other types of cancers. Sirtuin-1 blocks the activity of the androgen receptor. Mutated cells in prostate cancer, these androgen receptors are resistant to hormonal blockade therapy. So if resveratrol sensitizes them, it enhances the activity or helps the chemical agents for hormonal blockade to be more effective when they were failing. Resveratrol is considered an active agent against prostate cancer by researchers at the Anderson Cancer Center in Houston and other institutions. It works through more than 10 different anti-cancer mechanisms. It effectively targets cancer cells. It modulates hormones, has several mechanisms that prevent cancer cells from multiplying, and even has the ability to destroy cancer cells. Resveratrol acts as a chemopreventive agent, meaning it's a substance that helps prevent cancer in patients who have already had cancer to stop it from reactivating, or in people with a family history of cancer to prevent that oncogene from expressing. It prevents DNA damage and destroys cancer cells from very early stages to later ones, both in human experimental models and in animals. So it has proven effectiveness in humans. Resveratrol can be combined with other cytokines to enhance its effects. For example, it can be mixed with quercetin. Quercetin enhances the activity of resveratrol. Resveratrol enhances the activity of quercetin. Quercetin can improve the bioavailability of resveratrol and its anti-cancer effects. Oncaria tomentosa, also known as cat's claw, is usually used as an anti-inflammatory. But we should know that it falls under the concept of treatments that are not only anti-inflammatory, but also anti-cancer, especially for lymphomas, and for example, leukemias. It would also be interesting to use Oncaria tomentosa for solid cancers as well. The bioactive component is AC11 from Uncaria tomentosa. It prevents inflammation and protects natural immunity through DNA repair. So it's a DNA repairer. It regulates the nuclear factor kappa beta transcription factor, which is key in regulating the expression of numerous genes that are important for apoptosis. Therefore, Uncaria tomentosa is a DNA repairer. There are few DNA repairers. Uncaria tomentosa is anti-inflammatory, which helps control cancer proliferation a bit, since cancer itself stimulates the production of inflammatory cytokines to grow and spread, and then promotes DNA methylation or the repair or regeneration of DNA. Whey proteins are mainly used by athletes who take a lot of whey. They also have the effect of boosting the immune system and slowing down cancer development. Within the concept of whey, there's glutathione, which is also known for destroying reactive oxygen species, but it also detoxifies carcinogenic substances and ensures a competent immune system. The components of milk whey inhibit tumors through various pathways, such as inducing apoptosis, blocking angiogenesis, modulating the enzymes that metabolize carcinogens, and possibly also by removing iron, because excess iron is food for cancer cells. So, if we depress it, depriving it of the nutrients that make it strong, it will be more sensitive to any treatment we can perform. The problem with whey is, as you'll see, you can go to a gym and buy 10 kilos for maybe $50, but if you go to a pharmacy or a health food store, you might find a whey that costs $30 for just 300 milligrams. People don't think about quality, they think about the cost. I go to the gym, I buy 10 kilo or 5 kilo, which cost me a third of what this costs, and I have whey for a whole year. For a whole year, this lasts me 300 grams, so in a month I have to buy another jar, and it's $40 or whatever. So that's different. The question is how whey is extracted. You can extract it hot, which gives you a large amount of amino acids, because there are many amino acids in whey, but with low bioavailability. Or you can extract it cold, which gives you much less of the amino acids, but with high bioavailability. That work involves a cost. If from there you also filter it, and that filtering improves the concentration of amino acids and the quality of the amino acids, it's going to be a completely different cost. The quality is going to be much better, but it's going to cost more. When I talk about whey, I'm not talking about the whey from gyms. I'm not talking about that. I'm talking about pharmaceutical whey, whey from health food stores that has been extracted cold, and whey that has been filtered. This is what interests us about whey. Lycopene for metastatic prostate cancer, it's recommended to take approximately 20 milligrams or 30 milligrams daily, each and every day. It lowers prostate-specific antigen and seems to help with the control of prostate cancer. Lycopene administered on its own, without any combination, has anti-cancer activity in the early stages of prostate cancer. When it's advanced or when it has metastasis, it's not as effective, but if it's mixed with chemical or non-chemical products, it enhances the activity and can really help. For example, lycopene with turmeric is fantastic. For example, lycopene with selenium is fantastic. For example, selenium has a protective effect against prostate cancer. High levels of selenium reduce the risk of advanced prostate cancer. It's important to maintain high levels of selenium in patients with prostate cancer. We've already mentioned that coffee is good for prostate cancer. Drinking 2 to 3 cups of coffee a day is linked to a 30% reduction in the risk of prostate cancer. Men who drink more coffee have a 60% lower chance of developing fatal prostate cancer. Drinking coffee isn't as bad as it's made out to be. Many times we label it as toxic. So we need to reconsider that it's not toxic.